Prentice Steffen is board certified in emergency medicine and a fellow of the American Academy of Emergency Medicine. He worked for over 30 years in emergency departments in San Francisco, New York City, and Santa Cruz. As an emergency physician, he cared for patients facing every imaginable type of physical and mental health crisis. Prentice is also board certified in sports medicine. As chief medical officer, he helped build a professional road cycling team that continues to compete in the Tour de France each July. Prentice trained in psychedelic-assisted therapy under psychiatrist Scott Shannon at the Psychedelic Research and Training Institute, PRATI, in Fort Collins, Colorado. Amanda Edwards is a licensed clinical social worker who brings years of therapeutic experience to create a multidisciplinary approach in her work. She has trained with the Psychedelic Research and Training Institute, PRATI, on psychedelic-assisted therapy. As a social worker for the last 15 years, Amanda has worked in fields including community education, domestic violence and sexual assault support, substance abuse and recovery, family and children's services, and hospice. Pivotal in Amanda's life and work are connection to body, breath, and nature. Work with Amanda can include breath work, movement, and other embodiment exercises. Amanda also has a thriving sex and intimacy coaching practice. So joining me today is Dr. Prentice Steffen and Amanda Edwards from INNATE Integrative Medicine in Santa Cruz. Welcome to you both. Thank you for being on the quick trip.
Hi, Jen. Thanks for having us.
Thanks for inviting us.
Wonderful. It's great to have you. I would love to jump in and get to ask you some of the burning questions that I have for you today. So INNATE Integrative Medicine, based in Santa Cruz, is a really incredible space, an incredible healing clinic. I wonder if you could share with us a little more about the mission and the ethos that underpin your work at INNATE.
Yes, thank you. I think what really draws us to this medicine is working with ketamine can give us access to levels of consciousness and parts of our psyche that would otherwise be unavailable to us, to really work with those areas in a different kind of way. And being in a non-ordinary state of consciousness can also provide a reprieve from suffering, whether that's chronic pain or psychosocial, psychospiritual suffering or existential pain. And also can this work, the altered state of consciousness and the medicine work, in addition to the integration work following the sessions, can be really powerful in behavioral changes and making long-term changes for folks who have a variety of mental health issues, or also just want to do kind of a more psycho-spiritual exploration.
Well put. Thank you.
Oh, that's amazing. Definitely. I can I can hear how much thought you've put into this and the healing potential of ketamine. And I wonder if you maybe could tell us a little more about what inspired INNATE Integrative Medicine to come into existence. What do you think allows you to stand apart in the field?
Well, I'll take that one. I think in a very important way, we don't stand apart in the field. I think we are kind of a prototypical dyad therapy partnership where we both bring our special skills and expertise and experience together. We're not a big clinic. We don't, at least for now, have any plans or intention to be. We work as physician, social worker partners, taking care of clients that have issues that they struggle with. And we we both took the same training from the Psychedelic Research and Training Institute in Colorado with Scott Shannon. And we were in different training cohorts, but we found each other, and we found that we live like a 3-minute bike ride apart from each other. But I think to sort of add to what Amanda said a moment ago, the way I look at it as a physician, I did practice emergency medicine and sports medicine. I've said this 1,000 times. I'm sure Amanda's tired of hearing it, but I'm all about broken bones, heart attacks, strokes, and vomiting blood. But when I started getting very interested in this work, what struck me and impressed me with ketamine is how powerful it is at unsticking people. People are stuck. They're ruminating about their lives, and that's a basis of depression and anxiety and trauma and substance use. It's just being stuck in circular thinking, and ketamine disrupts that in a way that I'm not clear anything else does. And then once unstuck, then the trick, as Amanda alluded to, is the integration work and the process, the goal of staying unstuck and moving forward in a healthier way.
Thank you for that. I hear so much around the story of ketamine being a healing agent for people, and this unstuckness, this ability to get out of old patterns, old habits, the neuroplasticity that this medicine allows for, I know is a really a powerful component of the treatment and the therapy that people get. You mentioned the relationship that you get to have as co-therapists and working together on this kind of healing. I wonder if you could share more about that collaboration. How do you work together on this kind of psychedelic therapy, and what is that experience like for clients?
Yeah, talk about our treatment arc.
Yes, we can talk about our treatment arc. And I want to say, in terms of our relationship together, it's a very fluid process depending on the client and what it seems like they need and the support that they are seeking. So it's dynamic. Every client is different, and what we provide to each client is different as individuals and as a team. But our formal treatment arc is a 5-session minimum. The first session being an appointment that we have together with the client, which is a medical psychosocial intake.
Your introduction call first.
Oh, right.
Which you usually field. You always field.
That's right. So if anyone is expressing interest, whether it's through our website or through another community partner or a friend of a friend or whomever, we start the process with an intro call between myself and the potential client, just to explore what's up, what's alive, what's happening, what are some goals. And that's a free call. It's typically 20 or 30 minutes just to do some exploration and see if it feels like a good fit. And if it does, then we would schedule the medical social intake, which happens with both of us and the client. And then at least one intention setting appointment, which happens just with me. Intention setting appointments can always be added, but we require at least one, which is a time for us to really dig into what's happening now and what would you like to see happening. And if you could identify some goals, if you would like to feel different or have your life be different as a result of this treatment, what would that look like? And then the third session would be the medicine session, which we block out 3 hours of time, which is typically more than enough. And that happens obviously in person in our office with both of us present for the entire journey.
And I could say quickly what that involves medicine-wise, medically. And it would go back to the medical social intake. We do a thorough medical intake, so I know enough about each of our clients that I could be their family doctor. I mean, I get all of the info that is relevant to proceed safely with this medication. So once we've done that and Amanda's done the important preparation session, then we do the medicine session, and we bring people in. We have a really comfortable office. The picture's on our website. We're sitting in it right now. Mm-hmm. And we just kind of slowly prepare, I guess we prepare the space. And we do, just from a technical medical perspective or info, we do a 12-minute sublingual dose where we have the patient hold the ketamine in their mouths for 12 minutes, and it absorbs across the mucous membranes. And then we have them spit and rinse and then get very comfortable. And then we do the injection in the arm, just like getting a COVID booster or vaccine. And we have them with eye shades and noise canceling headphones with a lovely playlist. And then off they go.
And that part typically lasts after the intramuscular injection, typically lasts between 60 and 70 minutes. And sometimes folks are speaking, and I'm there to write anything down that they say and capture those words and experiences. And sometimes people are totally silent. But in any event, Prentice and I are both present for that entire portion. And then, when the client kind of comes back into their body and removes the eye shades and the headphones, they're invited to speak if they would like to, and they absolutely don't have to. What we find that there's often not language immediately that can really capture what the experience was. And we don't want to rush the brain back into turning on and having to assign language and almost classify, the experience. Was that a good experience? Was it bad? What do these words even mean? How was that for you? So we're there if the client wants to talk more, and if they don't, that's okay. Also, we make sure that they have a ride home, as folks are not in any shape to drive after their journeys. And within 1 to 3 or 4 days after their journeys, I've scheduled 2 integration sessions with them. And so to really, at that point, hopefully capture more of what their experience was, if there was any insight, if there were any experiences that helped them feel a reprieve from the suffering of their life or whatever it is that they're experiencing. And try to find a way to capture those insights and literally integrate them back, into their everyday life. And we can always add integration sessions also, and we could add medicine sessions, but at the very least, we're having that 5-appointment treatment arc.
That's so powerful. I can hear how hands-on it is, where you're really with clients at every step and providing, support if they need it, and also follow-up integration support. That I know is something that many people suggest is very helpful for metabolizing the healing, to actually have some time to not only feel cared for throughout, but really process after. I would love to get to ask you both about how your prior experiences and career histories have influenced what you're offering at INNATE Integrative Medicine. I know Dr. Prentice Steffen, you come out of sports medicine. Amanda Edwards, you're out of social work background. I wonder if you both have seen some elements of that influence the way that you offer care at INNATE.
Yeah, I'll go. Yeah, it's a great question. Well, my emergency medicine practice, I think, after my residency at UCSF, I practiced for 30 years, and of course, took care of the conditions that I mentioned earlier, but also, of course, mental health crises came before me all the time, and I just was reasonably clear that our system needed help and needed a new direction. And so when I started reading, and it's just been a little over a year ago now that I started reading about psychedelic assisted therapy, ketamine assisted therapy, I was really, really intrigued. And the more I read and the more I learned, and the training I did with Prati and lots of CME work that I've done. If I can put a plug for psychedelic support, I did the coursework there is like a graduate student level of training in MDMA, psilocybin, ketamine. So I was convinced that something needed to happen, that I needed to be a part of it. And as far as the sports medicine work too, I tried to understand that. I worked as team physician for a professional bicycle racing team at the Tour de France level. And I think there it was just when we were a small team and we didn't have a full staff, I was something of a very amateur sports psychologist, because psychology is so important for performance at that ultra elite level. But I think more than anything, I just got the idea of teamwork and working with, on a pro bike racing team. We have massage therapists, we have mechanics, we have coaches, and then we have the athletes. And here with INNATE Integrative Medicine, we have me, we have Amanda, and we have clients. And it really is a partnership, not just between the two of us, but with our clients, and working towards a common goal. And that's not winning the Tour de France. It's living a happy life and getting unstuck from those conditions and situations that are blocking that happiness.
Wow. And I think a lot of different areas of social work that I've worked in have really lent themselves to this work that I have kind of stumbled upon. Most recently in hospice for almost 9 years. And I think how that work has informed this work is the faith in that folks are on their own journey, and that we can be there to help and support, in transition, and maybe have some tools. But this work is between the journeyer and the medicine, and whatever the journey holds for them. We are not the experts in the room. That's kind of where INNATE came from. We believe in the inherent intelligence of our clients and in their bodies and wisdom and experiences. And we're there to keep folks safe and maybe ask some questions and provide, I think of the bumpers on the bowling alleys, to keep people safe and within, within a certain container. But other than that, really allowing the experience to unfold how it will, and removing our own sense of I'm the expert in the room, which I think a lot of mental health models have, that the professional and maybe pharmaceuticals are the experts and not the clients and their experiences. So yeah, hospice taught me a lot about that. And my other experiences in addiction and recovery and harm reduction and working with families and children, and really the idea of plans that folks make for themselves have the best outcome. It's kind of a different way of saying the same thing as I'm not the expert. I'm not going to make a plan for you or a case plan or anything like this and say, this is what you need to do, complete steps A, B, and C in order for you to be successful or get what you want. It's a collaboration, a team effort, like Prentice said, with heavy emphasis on that people have all the wisdom that they need, and they just need to find access to it in some way that's been blocked.
Wow, thank you both so much for giving that background. It just really resonated, that comment about trusting the wisdom of the individual and that they have what they need to heal. I think it's so needed in psychedelics right now, when a lot of the focus kind of from media coverage in general is that these medicines are maybe a magic pill, a magic bullet. And they're very helpful, but they are also really rooted in each person's innate ability to heal themselves, and they help unlock that. But they are a facilitator, not the journeyer themselves, and that person really should be at the center of the care, which it sounds like you put them right there in kind of a driver's seat of their healing, which is really powerful to get to hear. So you both were trained at the Psychedelic Research and Training Institute, PRADI, and you've mentioned that as being a source of grounding and knowledge for you both. Our community is always looking to learn more about trainings and how to be good clinicians. I wonder if you could share more about some of the trainings that have helped to inform your practice.
Well, that's a great question, and gosh, the number of opportunities that people have to do this training is impressive and growing. I don't personally, apart from what I mentioned earlier with CME work through psychedelic support, I haven't done any other live or training, but I think it's fair to say that there are certainly some other very reputable, roughly equivalent training programs, the Ketamine training program or Ketamine Training Center with Phil Wolfson. And then there's a new group down in Southern California, the Psychedelic Coalition for Health. We've recently met and collaborated with someone that was a member of their first training cohort. And I think they, from what I know of them, they're impressive. And then of course there's MAPS and there's CIIS and there's IPI in Boulder. So there's certainly no shortage of opportunities. That said, I don't think any one person needs to do all of them, but at some point it's a matter of knowledge and motivation, and then dive in and start doing the work and getting the experience. And that's honestly, a bit where we are. I was going to say, and I don't know if this is kind of a side topic, but as far as the treatment arc goes, we also really like to have clients that have a relationship with a therapist, and then we sort of slot in and then send them back. Maybe this is a good segue to Amanda. I mean, some of our clients have been her coaching practice clients, and so there's continuity that is super important there. And Amanda does some interesting coaching work.
I do do some interesting coaching work, and I also want to speak to what Prentice said about making sure that clients are either working with a therapist or a coach or have some continuity of care, so that we're not just like grabbing them out from the wind, doing a few sessions and sending them back out. So we want to make sure that there are allies and support people and systems with our clients, so that it isn't just this kind of lone, experience, and then they're going back out to kind of venture on their own. And some folks have continued on with me with multiple integration sessions, or transitioned into my coaching practice, which is more sex and intimacy and relationship. And what we found is that so often these things are all braided together with potential clients. Treatment-resistant depression, anxiety, PTSD and trauma, or having this kind of existential, again, like psycho-spiritual pain that can't quite be encapsulated in any diagnosis. So I, obviously have a cap in the number of folks that I can continue with after their journeys. So we're really doing an assessment beforehand of like, who are your support people? What are your networks? Do you have professionals in your life who you can continue to work with after you come and have this treatment arc with us? And in terms of my training, I would say that the majority of the psychedelic focused training came from Prati. But my work with clients during the medicine journeys and in our pre and post sessions are highly informed by somatic therapy. And again, dropping into the body, tapping into the wisdom that's already there, getting out of the chatter in the head, in our heads, which, is really incentivized, I think, in our culture, like make it make sense, make it rational, make it fair. And coming back to like, feelings are feelings and desires are desires, and they don't have to be rational. They don't have to make sense in black and white. And really kind of cultivating that confidence and like trusting your body and listening to those sensations and what are they trying to tell you and how can you follow them?
Is it worth talking about your work with the Somatica Institute? You're a trainer, it's part of your practice.
So I guess so, maybe. The Somatica Institute here in the Bay Area in California is where my coaching training comes from. And I went through that program in 2018, that main year-long program in 2018, and then have done all the subsequent trainings that they offer. it is specific to sex and intimacy and relationship. And I went through that program just for my own development and kind of self-inquiry, and was working full-time at hospice, was a social worker, no intention of having any type of private practice, and started talking to friends and acquaintances about the work there, and came out the other end with a coaching practice, just because the ideas and the philosophy around that type of coaching is so different than anything else I had experienced. And so that's largely the somatic piece. What is your body telling you? You can trust it. Learn the language of those sensations and what it's trying to tell you, and to believe it, and drop out of the head and into the body. And so we're doing that a lot with this medicine, which is interesting because it's a dissociative. And so when I first started reading about prati and about ketamine assisted therapy and the dissociation piece, I thought, like, I'm trying to get in my body, not out of it. All my alarms went off in that way. But I think part of the magical piece about this medicine is that it's the reprieve from this loop that we talk about, this groove that we're kind of, we get stuck in, that we have the same thoughts, that we're playing the same tape over and over. And the dissociative piece of the ketamine allows us to get out of that groove and get out of the loop, and see these experiences from a completely different perspective, and kind of like allow our body to metabolize them in different ways, so that we're not experiencing the same trauma over and over, that we're not having the same invasive thoughts of anxiety or what could happen or what might happen if we leave the house, or if we, get in the car, or whatever's happening. So that's the key piece of the dissociative that I was at first really skeptical about, is that it allows a different perspective that we wouldn't have otherwise.
Thank you for framing it that way. I think that is, often a question I have heard from folks once they learn a bit about ketamine, is this idea of, it's a dissociative. That's really different than a lot of other medicines. But I really appreciate the framing of getting out of the loop and getting to just kind of step back from the noise that's going on and look at it in a different way. That's really powerful. We got to speak a little bit about this when we had a break earlier, but I am curious, with all of your amazing skills, your histories and backgrounds, and the care you bring to the work, what is next for INNATE Integrative Medicine? What are you growing into?
I'll take a shot at that. It's a bit of a continuation from the training, and then just on the job experience. But we've also been fortunate to join with a pair of ketamine therapy dyad partners in Monterey who have been doing this for longer than we have. And then there's another ketamine provider who's sort of in between geographically, and basically it's a therapist peer support group. And so we've been meeting quarterly with them, and that's super valuable to learn from peers. Mentorship approach to some extent, but I think that a lot of groups, or a lot of therapists are doing that, and we're sort of scheming to get a group here in the Santa Cruz area in the near future. That would be one of the directions that we're headed. Again, I don't think that we have any big plans to. I attended a webinar the other evening with a marketing speaker, and he was talking about the 7-figure ketamine clinic, i.e. $1 million, 7 digits income. That is really not us, and I don't anticipate will be. I think that we just want to do our work here with the people that come to us, and help them.
Yeah, I agree with that. I think the clients who are meant to be here are finding us in various ways. And in addition to continuing that kind of stream of clientele, we're still learning about our capacity in that way. You know, I have this whole other coaching practice, and Prentice is retired, so we're not trying to put him back to work full time. But in addition to the direct client care, I am also super interested in groups and support groups, and both for other practitioners who are doing this work so that we can really collaborate and can create that continuum of care that we talked about. You know, folks in the community who maybe don't want to sit with the medicine, but want to know enough about it that they can refer to us, and then we can do our piece and then send them back for more long-term integration. I really love the idea of demographic specific groups. Like I know I'm aware of some groups on the East Coast that are doing groups specific for nurses who have been dealing with the COVID pandemic for the last 2 years, or social workers or firefighters, or, you know, I really like the idea of groups in many different forms. And I think we kind of just have to wait and see how that takes shape. But I think there's something really powerful about the group field, which is to say multiple folks journeying at the same time in various forms. So yeah, support groups, peer support, actual journeying groups, all different kinds of things like that. I also, we've talked about this briefly, but would love to identify a population whom this might be unavailable to. Like I know in the Santa Cruz mountains, they're looking at a property to house homeless veterans, getting connected with some type of population like that, where we can provide services to a population who might not have the resources to pay for it or something like that. So that's somewhere in our future too. We're just kind of seeing what stepping stones appear. That's how we've gotten to this point. It's working out pretty well.
So far, so good.
Yeah.
Wow, that's so exciting and wonderful that you've gotten to watch it grow organically, and that you feel like you are attracting the folks who are meant to be there and finding good connections. I want to just show the website for folks who are looking to get engaged. Do you have any advice or recommendations for people who might want to reach out to you?
I think we have some great information. We have a resources and documents page on our website that has some really great kind of like more accessible, less clinical, you know, more accessible information about like why ketamine, why would you start here? What are the benefits? Things like this. That felt really important to me to make it like someone who didn't know anything about ketamine or have a medical background could read it. Someone like me, essentially, you know, a few years ago, who could read it and try and make sense of it in their own life. And so we tried really hard to find information to put on our website that spoke to that.
Oh, that's great. And I'll make sure for folks watching that will be linked in the blog down below. So don't worry, you'll get to have access to that too. Yeah, that's really wonderful. Well, we appreciate you both making time to be here today. Thank you so much for sharing your wisdom and insights. And I can't wait to hear more of all the incredible work going on at INNATE Integrative Medicine.
Thank you.
Thank you, Jen.